So what about your heart? Do you ever have irregular heartbeats or anything?
Nothing. Didn't even feel it other than just notice it.
As you may know, atrial fibrillation is a very, very common disorder. It's the most common abnormal rhythm of the heart. There are about 2.5 million people in this country with atrial fibrillation now.
Atrial fibrillation is a disorder of the upper chambers of the heart. It doesn't really know when to contract, so it just kind of fibrillates. And then the ventricle is disordered and is irregular. It goes boom, 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 boom. But the atrium just kind of quivers.
Even though we don't view it as an imminently life-threatening problem, it certainly impacts quality of life. The patient may feel very lightheaded or winded or fatigued easily. The presence of atrial fibrillation increases the risk of stroke by about 5-fold.
The first thing to do is treat with medicines, and that's what we try to do with most patients. And catheter ablation and surgery are kind of like steps 2 and 3. You really need to kind of work with one of your doctors and a doctor that specializes in atrial fibrillation to get a sense of how bad is it for you.
No two individuals are identical, is that every patient needs to be looked at as a unique individual. And we really try to match the right treatment with the right patient. Most of those patients who need more aggressive therapies will undergo an ablation procedure. We go into the heart with a catheter and we eliminate the source of the atrial fibrillation. In some individuals where medication was not successful and ablation was not successful, then those are the individuals in whom we might want to consider surgery.
The unique thing about Northwestern is we have a center for atrial fibrillation. Unlike most centers, where they separate surgery and medical approaches, we combine them.
The goal for the Atrial Fibrillation Center is really to provide integrated, unique care for our patients with atrial fibrillation. The other purpose of the center is really to integrate research. We know that every time we see a patient, every time we do a procedure, we often come up with more questions. And we have the resources here and the personnel in terms of research to try to answer those questions, to maybe not only help that individual, but maybe future generations of individuals with atrial fibrillation.